This presentation is going to focus on students who have sensory, communication, physical, or health impairments. And so with these categories, it's important that the team look at the etiology, the cause, as we look at the developmental history of the student. However, knowing the cause is not going to change the services that the student might receive, but it gives the team just a broader understanding of the student and their background. So often you'll find that there are biological or environmental factors that have caused some of these impairments. And so part of the developmental history that the parent would provide would let us know that if the student developed this impairment prenatal, before birth, something was happening while the fetus was developing. Sometimes we'll find that physical impairments or sensory impairments were caused by something that happened during or shortly after birth. And then, of course, sometimes there are things that occur in early infancy or in the toddler stage that might be an accident, might be due to other environmental factors that present themselves as one of these impairment areas. And so the IEP team, of course, looks at that developmental history, looks at all the documentation in these different areas to see if they qualify for services. In some cases, particularly probably with physical impairments, orthopedic impairments, those students may actually be identified before they've started school. If a student was born with blindness, was born deaf, then those parents have probably been getting early intervention services, and they may already have services even before kindergarten. However, there are definitely going to be times that you as the teacher may be the very first ones to notice some of these characteristics. You might see that a student isn't picking up on language. You might see that a student is tugging at their ears an awful lot or going to the nurse with earaches. And so you might be the one that brings the awareness to the team. And then, of course, your school personnel would help make that contact with parents. And if there is a medical assessment that's needed, then the IST or the SST coordinator, the special ed administrator, could help have that conversation with the parents. And it wouldn't be a conversation really probably that you or I would have as classroom teachers as far as recommending medical assessments, but it would be part of how the team would approach and work with the parent to help them know their resources. So with any of these areas, even if a child exhibits characteristics of having a disability, the eligibility team is going to talk about and discuss if it interferes with the child's educational performance. Do they need specially designed instruction, and do they qualify for special ed services? So if a student is found eligible and they receive special ed services in these categories, there are specially trained teachers who may have more knowledge and expertise to provide services. So they are special ed teachers. And then there are also related service providers. So if a student has a vision impairment, their case manager may actually be a vision impaired teacher who has the background and knowledge of how to work with students with visual impairments or blindness. They would help the IEP team in knowing how to adapt material. They would know assistive technology that would be appropriate to work with different students, and they would help provide training to staff who need to know how to utilize those equipment or devices. And then we have teachers on staff who are teachers of the deaf and hard of hearing. They are hearing impaired teachers. They are specially trained in this area. They may or may not know sign language. So not every student who has a hearing loss or every student who is deaf is actually taught sign language. That's determined by the team and really the experts on what type of communication system the student needs, but sign language can be used and is sometimes taught in schools, or an interpreter is brought in to work with the student. The hearing impaired teacher also knows how language develops over time and different ways then to present concepts based on the child's language needs. And of course, they're going to help with adapting materials and helping us alter our instruction for delivery of our content and assessing our students on their knowledge. And in both these cases, there are program need classes. So sometimes the hearing impaired teacher is the teacher of the content. Sometimes they're going to be maybe in a co-teacher setting, and sometimes they're just going to be training us as we support students in the general ed setting. Then there are also orthopedic impaired teachers who have special certification in physical disabilities or health disabilities. So again, they lend their expertise to the IEP team, help develop the IEP. They might be the case manager for the student. And some of these teachers are itinerant, so they may travel school to school to work with a caseload of students, and they just help the general ed teachers or help the special ed teachers implement the IEP, and they serve in the itinerant sort of consult role for students. In addition to special education teachers, there are also related service providers who work with our students. And so students with vision impairments or blindness may have an orientation and mobility instructor. They often help students who need to use a cane to navigate the environment in the school setting. They also go in the community setting to help students. Some students with physical impairments, orthopedic impairments, also have a physical therapist to provide services. So they look at the equipment, they look at the desks that are provided for students, they look at how the student transitions in the school settings to see what supports are needed. And then students may have deficits in fine motor skills, and so they may qualify for services with an occupational therapist. So think about all the tasks that we do that require fine motor agility, cutting, gluing, buttoning, zipping, feeding, eating in the cafeteria. So if they have fine motor needs that impact their educational performance, then they may have services from an OT. And I don't even think I mentioned handwriting. So of course, handwriting is often addressed with OT services. So students may qualify under communication disorders, and the SLP will be their primary provider, their case manager, or speech language might be a secondary eligibility area, and the SLP is providing the supplemental service for the student. Students with hearing loss or deafness may work with an audiologist. The audiologist can assess the environment, look at what type of assistive technology or devices, amplification devices might be needed. They help with hearing aids and teaching students to use them, helping teachers be able to help students manage their hearing aids or other devices. Again, an optometrist may be working with our students with vision impairments. And then in some cases, students with other health impairments or orthopedic impairments might need nurse services. So that can be written into the IEP as a related service. I have never seen a physician written in as a related service provider, although we do get medical documentation as part of that evaluation process. So, in the eligibility area of visual impairments, there's not one criteria, there's not one characteristic where a student may be eligible. There could be a range of vision loss that would help qualify them for special ed services. So I'm going to let you take a few seconds to skim over this slide just to get the different types of vision impairments. This also just presents more ways that a student's vision can be impacted. So I'll let you read through this information. So there are more examples of different eye conditions that a student might present with. And so the IEP team, eligibility team, would have this data, this documentation, to have a full picture of the vision needs for the students, including eye exams. We would also look at a functional vision exam, so how it's impacting the student in the classroom and in the school setting, which helps us determine more specific accommodations for that student. And so, of course, when the IEP is developed, we would look at accommodations in these general areas. So this is not giving specific accommodations, but it's certainly areas that we would look at to see what supports are needed for the student. All right, another category, of course, is hearing impairment. Again, there's a range of hearing loss, so students may qualify under that area of being deaf, or the student may be hard of hearing. There are different degrees of hearing loss and different causes and types of hearing loss. And again, this just gives us a full picture of the student, and our experts in this area would help explain really what this means and how this presents in the classroom. But there are things that you might see as a teacher, especially if a student has not already been identified as a student with a hearing loss. So I like this because it gives you different characteristics that you might notice and say, you know what, we might need to look at a referral. I might need to talk to someone in the school to see, like, is this a sign that the student could have hearing loss? So you might notice if they scratch or pull at their ears often. You might notice, especially if they frequently ask you to repeat the directions. And it could be a lack of hearing them, but it could also just be a lack of comprehension, not hearing it clearly. So some of these signs, if you pick up on them, follow your instinct, follow your hunch, talk to someone in your building, in the special ed department or with your SST coordinator to let them know what you're observing, and then they would help know what are those next steps for referral process. And so when the IEP team is looking at eligibility or services, we're looking at the severity of their loss. We often want to know at what age do they develop the hearing loss, because that really affects their communication and language development. And then the hearing impaired teachers, the audiologists, the speech therapist, they would help determine what is the best communication system. Again, not every student who is deaf is going to learn sign language. And then again, not all students are deaf, they may be hard of hearing, and so there are different ways to develop their communication through symbols. Sometimes it's going to be through speech and oral means, and sometimes it'll be a combination. And so again, once the IEP is developed, the team will look at accommodations that are needed. Assistive technology will often be utilized for kids with hearing impairments. And then of course, they would help us know specifics as far as our delivery of instruction, how to help the student show what they know on assessments, and so forth. And even just a common one is making sure that we use the closed captioning when we're showing videos in the classroom, or when you're recording yourself, even on Teams, you can have the closed captioning turned on. So this are some of the accommodations that you might see written into an IEP for a student who's deaf or hard of hearing. So I'll let you read through these examples. I am sorry, this is blurry at the top, and these are more accommodations that you might see written into an IEP. All right, another area of eligibility is communication disorders, which often you'll hear referred to as speech language impairment. And so, of course, communication and speech is a very complex process. When you really break it down, you're talking about receiving information, being able to send information, process information, comprehend the information, and information can, come through verbal or nonverbal, and even graphic or symbols. So there's lots of ways that a student may have deficits in their communication skills. And so the two main areas, we look at language and we look at speech. So language is more the expressive and the receptive, being able to use language, comprehend language, produce language that makes meaning. And then, of course, there's more the motor part of being able to produce the speech sounds and to be able to do so fluently. And so their speech therapists are trained, of course, in these areas. There are 5 areas, if there is a speech evaluation, that the SLP will make sure to assess with the students. And again, communication is broken down into different components. So there's articulation, there's voice, and there's fluency. There could be language disorders, and then there can be communication disorders. And so again, if they're found eligible for services, we look at accommodations to help address their needs. And certainly speech language impairment is one of those areas that may not be identified until a student starts school, and you as the teacher are the ones that's picking up on signs and characteristics. And so you might notice in the way that students use language, some students have difficulty retrieving the word. It's that tip of the tongue syndrome. They know what they want to say and they just cannot produce the word to express their thoughts. They may use a lot of words. They might not be able to get to the main idea of something, so they talk a lot but don't really get to the main point. Some students have a limited vocabulary. Some students have difficulty putting things into categories, and they may not understand the hidden meaning or reading between the lines, expressions that we use that are not literal. For some students, it's going to show up as deficits in syntax, how they put words together to form their thoughts, whether spoken or in writing. So they might have trouble understanding the grammar rules. They might use simple sentences. They may have prolonged pauses because, again, they're trying to organize their thoughts. And when they do so, you may hear a lot of fillers like because they just can't produce their thoughts in a coherent way. And then they may have trouble using language effectively to communicate. So maybe they have limited expressions that they use over and over. They might not be able to give clear directions and explanations that follow a logical order. They might not actually know how to ask questions. So you can tell they didn't understand directions, but they're not able to pinpoint and ask you a question of what to do next. And so you may pick up on that for students. They might have difficulty with conversations, grasping the main idea, and making inferences. So again, if you see these characteristics, these deficit areas with a student over and over, again, follow your hunch. I say contact your SLP and just let them know you have a student you're keeping an eye on. And then oftentimes I find that they're very willing to come observe and then help you know how to navigate what that next step would be in the referral process. So always reach out if you have a question, if you have a concern about a student. Another eligibility area is physical impairments, which under IDEA and under our Georgia eligibility rules, we really talk about this as an orthopedic impairment. And there are lots of different types of orthopedic impairments. Not all of them will be to the severity that the child needs special education. They may need accommodations with a 504 plan. It's really about how it impacts their educational achievement. Often, of course, with a physical impairment and orthopedic impairment, the parent is already aware. They're probably already getting medical attention. But it may not be that it has caused any disruption in their school setting until they get into kindergarten or until they get into other classrooms where they're making more transitions. So this might become a referral at any stage, whether before they get to school or after they become school age. And so different types that fall under this category: cerebral palsy, which there are different kinds of cerebral palsy. Students might have a spinal cord injury, spina bifida, muscular dystrophy, limb deficiency. And so these are just some common examples of orthopedic impairments. And so if they qualify for services, of course, the team is going to work to develop a list of accommodations that help them access the curriculum, make progress in the curriculum, and be able to navigate the school environment. Again, you may have physical therapists or occupational therapists that are also part of this IEP team because they may need equipment, they may need special devices for physical limitations. Another eligibility area is health impairments, which actually we refer to as OHI, other health impairments. And they are medical diagnoses that a student may have that limits their strength, vitality, or alertness in the classroom. And it's due to a health problem that's been documented by a physician. So these are some examples that you might see under OHI. One that is not on this list is ADD or ADHD. That is considered under OHI as well. And so students who qualify under other health impaired are going to present very differently. So that one eligibility area covers a lot of different types of impairments. So it was important to read through the IEP and see how their disability impacts their educational performance. And of course, to look at the different accommodations that apply specifically to this student and to this need. One last thing just to emphasize with each of these categories, whether it's communication disorders, orthopedic impairments, vision, hearing, or health impairments, often we have preconceived notions when it comes to students with special ed services, but it's really important that you look at each student as an individual, even though they may have the diagnosis as another student that you've worked with. The way it presents is going to be different and unique to this student. And also, with these impairments, there may or may not be any intellectual disabilities. Many of these students are going to be at or above average intelligence, but the way that their academic achievement shows up might be delayed because of access to the curriculum. Because of a vision impairment, they might be slower to learn a concept, but it's really the way that we're presenting it, perhaps, not their ability to learn it. So just want to make sure that there are no preconceived notions that these students are functioning lower than their peers because they qualify for special ed services. Again, each student's going to be unique in how it impacts them and how it impacts their learning. So just remembering the I in IEP, that everything is individualized.